Hi, this is Rich Feifer, Chief Medical Officer of Genesis Healthcare. We are so excited that more and more vaccination clinics are being scheduled each and every day so that staff and residents are protected against COVID-19. Reports from around the country, from all of our centers, are overwhelmingly positive. We've had so many residents and staff vaccinated to date, and side effects are actually quite rare. Millions of Americans so far have received the first dose of the COVID-19 vaccine, and we're hearing that the most common side effects after the first dose are a sore arm or maybe headache or a feeling of fatigue. I personally just had a sore arm and had nothing else after that. And those side effects are to be expected as your body mounts an immune response, and they generally resolve within 24 to 36 hours. But we're also hearing among those who received the vaccine, even those who experience these mild side effects, that they're also left with an overwhelming feeling of hope. Hope that for the first time in more than 9 months, we may finally start to think about what life looks like when we're on the other side of this pandemic, when we build community immunity. And this isn't going to happen overnight. It's going to take some time. And here's what I want you to know about that. Vaccines don't work instantly. It takes at least 7 days for the body to start to mount an immune response after the first dose. At least 7 days for even partial immunity to take effect. But to have full immunity, we need that booster dose 3 or 4 weeks later. For that reason, the CDC and Genesis continue to recommend full infection prevention precautions for an extended period of time without change. That includes face masks, physical distancing, excellent hand hygiene, all those other things that we've emphasized throughout this pandemic. So please keep up that really good work. And the faster we have large numbers of staff and residents, and the faster we have more and more people in our surrounding community vaccinated, the sooner we'll get back to normal.
Hi, I'm JoAnne Reifsnyder, Chief Nursing Officer for Genesis Healthcare. With vaccine distribution amping up, we know we're on the right path finally towards providing protection to those who need it most. But as Dr. Feifer said, we need the majority of staff and residents vaccinated in order to begin to look towards some return to normalcy in the future. Despite the many staff and residents who have excitedly rolled up their sleeves, we know that there continues to be some hesitancy. Some of you jumped in line as soon as you heard that the clinics were coming. Others are leaning towards getting the vaccine, but just want to wait a little while. Others' minds have been changed by attending one of our Ask the Doc sessions or reading more information. And we know that a few others still remain on the fence. We've heard from staff with pre-existing medical conditions who, after consulting with their physicians, decided that the vaccine was the right choice for them. We've heard, for example, from a breastfeeding mom who, after doing her research, chose to get the vaccine to protect herself and her infant. And we've heard from staff who are apprehensive about the long-term effects of COVID-19, many of which are still unknown, and they weighed those risks of the disease against the potential temporary side effects of this vaccine. We understand the struggle, but we also want you to know that we're committed to providing you with information and education to help you make an informed decision. There's a lot of noise out there, and it's more important than ever to lean on unbiased sources of information about the vaccine. We can help you through our Ask the Doc sessions, and we can point you towards reputable, science-based resources and answer any question that you have about the vaccine. As we move through this process together and as more clinics are scheduled throughout the coming days, I wanted to share one more thing with you. Our Genesis core values of respect and appreciation and honesty and integrity ring especially true right now. We respect and appreciate the different journeys you're on and the histories you bring as you consider the evidence for vaccination. We are committed to honesty, integrity, and full transparency throughout this process by providing education and information that you need to make your decision. For the past 9 or so months, we've shared a collective experience unlike any other in our lifetimes, one that we will all happily put in our rearview mirror when we can. I have an ask for those who have already received your first dose of the vaccine, like I have. Please share your experience and journey towards vaccine acceptance within your center. Let your coworkers and residents know how you overcame any concerns you might have had. Tell them what sources you consulted to help you in your decision. And as you share your story, do so with respect, appreciation, honesty, and integrity. This is our shot towards the beginning of the end of the pandemic.